thank you for coming. It's always a bit risky when you have parallel sessions, whether you see anybody or that you are the less interesting subject of the afternoon, but thank you for coming anyway. The second thing is, it's not easy to tell a story of 20 years in 10 minutes only, but I'll try. This is Ghana, where I work. I don't think it doesn't need any further outline. The only thing which is interesting, 1957, Nkrumah founded the First Republic, and since then Ghana is a rather stable, political stable country where you can build something. Please, next. In 1961, a certain brother Tarcisius, a lay brother, entered Ghana with a mission. He was an orthopedic shoemaker, instrument maker, and you know, at that time there were many, many post-polio patients, and his mission was just to care for them. And he built a small workshop in the backyard of his convent near Accra, near the capital, in a place called Nsawam. And very soon he decided not longer sit and wait until the patients came to him, but rather go out and be proactive. Just drove around. He picked the patients from the street, as I have seen several times, and he extended his trek, as he called it, trek for as long as the whole of Ghana, up to the border of Burkina Faso. The pathology he met was not always post-polio patient, as the middle one here, but a lot of other diseases, club feet, severe knock-knees, Blount's disease, both legs, and I say here a miscellaneous group of all kinds of congenital and hereditary abnormalities, and the terrible disease which is called arthrogryposis. So a lot of these diseases, just a few examples. Can we go one back, please? So he was too happy when he met in 1984 an early retired Dutch orthopedic surgeon. Because of deafness, he could no longer work here, but together with his wife, who could read his lips, the couple could work perfectly in Ghana. And together, they found out which hospitals were suitable for doing surgical corrections of these severe disabilities. And they stuck to 2 hospitals, which I will show later on. Unfortunately, in 1994, he got terribly ill and asked me to succeed him. I was a former mission doctor living 3.5 years in Zimbabwe, and worked 2 years in Sierra Leone before, worked 3 months in the tsunami in Aceh, was a bit experienced, and I accepted his invitation and went to Ghana, please. This was the situation in 1994 when I entered Ghana. This is the Orthopedic Training Center, OTC as we call it, near Accra. This was the trek. So in the meantime, you know, twice a year, the rehabilitation doctor, instrument maker, covered the whole of Ghana, and several times more, the more crowded, populated coast. He went there with a small van, workshop. He did small reparations on the road, extensions, enlargements of calipers, of growing children, shoes, and so on. And the bigger problems, he either referred them to the OTC, or when they needed surgery, they had decided upon 2 hospitals. And the first one is the St. John of God Hospital in Douala, Kwanta. And when I went there in 1994, the first time, I met a young, enthusiastic general doctor, Dr. Mo, and very soon, at least from the beginning, he was interested in orthopedic surgery, and he told me his personal mission. He said, I come from the north, and I've chosen this hospital to be there to give outreach services to my poor people in the north. There is hardly any medical provision there. So he pressed a little bit on me, and very soon he was in the Netherlands, in the University of Maastricht, being trained as an orthopedic surgeon. In the meantime, going with me up and down May and November to Ghana to do this operations here, and there was also a kind of a teacher-apprentice learning system. When he was finished, he qualified as an orthopedic surgeon. He settled there in this hospital, and now we had a continuous orthopedic care there, and all the more simple operations were done from then on the whole year around. Then several times we traveled right in the north just to see what other hospitals could be included in our, let's say, foreseen orthopedic network of Ghana. And we visited, we talked to boards, and we had interviews with the local specialists, and we decided upon two, Nandon and Boku, as the most suitable hospitals for a future network. This for the western part of Ghana. So all the patients from this side were referred here, all the patients from the eastern side were referred to the St. Anthony Hospital. And there I happened again in 1994 to meet a young doctor, a general doctor, Dr. Korpisah, sitting here right on the first row and following me as a speaker. And this was his beautiful hospital. And this is the Orthopedic Training Center, this is the St. John. So this actually was a situation when I came 1994. And I traveled like Albert Schweitzer in a small van with 10 aluminum cases in my back, all the orthopedic instruments. I traveled from the one hospital the first week, the second week to this hospital, and I did it so many years until we had two qualified orthopedic surgeons there. In the meantime, looking ahead. Next, please. From all these hospitals we visited, we invited just some young general doctors to join our team when we were there, trying to make them enthusiastic for our orthopedic work. And that's not so difficult because orthopedic surgery is so visible. You see a crippled someone, you see a crawling someone, and 6 months later you see the same one standing, you know. Let's say it's a increase in human dignity. Now you can talk level and no longer only this one. So they all became enthusiastic and asked after some time, couldn't we go into training? And I said, yes, you can go into training. When I was sure that they would come back, that they were enough motivated to come back to their own people. And so they found all their own ways to be trained. You know, Ghanaians, they do the medical studies all over the world, so many went back where they were originally trained and asked if they could go into training, further training as orthopedic surgeons. So Dr. Mo Maastricht, Dr. Korpisah, he found his own way in Accra, the Korpisah University. Dr. Tuni went to Uganda from Boku. Dr. Afaccio, he went to the Ukraine, he as a medical student, came back to St. John of God. Dr. Balu, he's now in Japan doing spine surgery. He was also in the Makerere University in Uganda. And Dr. Amesia is in his last year and will come back to next year in Nandon and will be. And you see Dr. Amesia here amongst my colleagues of the Tergoy hospitals in Blaricum. They, for already 5 years or so, they are willing to get the colleagues in training who need an overseas stage to see the whole width of the orthopedic specialism. And this is just a month ago. He was trained there for his last week. Yes? And this is a situation now, 2014. You see the orthopedic training center, the rehabilitation doctors still going around. We're having now more centers to refer as patients. So you see, this is half of France, Ghana. So the distances are large and the roads are not too good sometimes. So many patients, especially, can be operated in their own area. And still we do the kind of supervision and maintain the training, and we be kind of a mentor. And I think that is how it is. And Dr. Frank de Ruiter, he is the one that from the many colleagues I took along the line, and residents and assistants and technicians, very important, physiotherapists, theater nurses, I all took them so now and again along, and only Frank now has stayed with me, and he comes in February to supervise those two. I come in May and November, and that is the situation as it is. And I think it's a nice infrastructure also to start our Ponseti treatment now. We no longer wait until it is fully developed, the club feet, but try to be right at the roots there. And we have our trainers amongst the same doctors. And I'm very happy now to give my small light to Dr. Korpisah, and ask him a question: what inspired you to be part of this infrastructure? Joseph.
Thank you very much. As he said, in 1994, I met him, and what actually attracted me, I think the precision of orthopedic science. In fact, I have gone through several disciplines in the medical school, but when I started with orthopedics, I was really fascinated with the large armamentarium of equipment available to the orthopedic surgeon, the outcome of surgeries that was being done. In fact, patients with crooked legs go to theater and come out very satisfied with what has come out. I was so much interested. And of course, I must say I had some admiration for the surgeon. This was a top-class surgeon, very good with the knife. I thought, well, maybe I could also become good that way. And of course, the hospital itself has something to do with it, and you will see what I'm talking about. Next slide. Yes, this is the entrance to our hospital, and this is the driveway. You can see all these trees, a really cozy and then healing environment for somebody to work. Yes. St. Anthony's Hospital is a 172 bed capacity hospital. It's a district hospital in the part of Ghana called the Volta region, with a population of about 2 million people. We offer a wide range of health services, starting from preventive health service into orthopedics. We are now also quite famous for urological services, which is being rendered by surgeons from Germany. Beside the regional hospital, our hospital is the only other hospital that offers orthopedic and trauma services, and the region has got over 20 health facilities. What services do we offer? And these services are what we do in the 3 hospitals that has been established. I would like to repeat that one of the most important things about our setup is the fact that you can see it was an orthopedic shoemaker who started all this program, as in the morning it was being said, not even a surgeon. Our main core was to do corrective surgeries for the various deformities, congenital and others that were there. But of course, we soon realized that trauma was very important with open fractures, non-unions and malunions, infection, TBs, and osteomyelitis was there. The deformities I've already talked about. Bone tumors, unfortunately, we have a lot of osteosarcomas in our region. And of course, you need to also venture into some level of plastic surgery because you have to do your own covers and then split skin graftings. Yes. Of course, you are a trained surgeon. You cannot be a jack of all trades. You will need a willing and motivated staff. And I'm very grateful to these people because from there you get your supporting staff, the anesthesia, physiotherapy, laboratory, and all the others. That's right. Yes. How did we establish the infrastructure? I am not here to teach people how to build a new hospital. I'm just telling you how we managed to get our infrastructure. Like most people said, we didn't go for anything too high. We had got a hospital already working, so we just had to do certain basic changes. And the theater was very important. At St. John of God, they had to build a new theater. We decided just to do some renovations. At least we had to separate where the patients and the staff entered. We had to add a minor theater. We needed a scrap area with taps as here. We needed to put glasses at the windows and then the doors to create air conditioning so that the infection rate may be a bit lower. And of course, we had to take care of the comfort of the staff too. What about equipment? Well, as everybody is saying, this is Africa, so we weren't going for anything high-tech. We looked at the pathology we were dealing with. We had a lot of open fractures. We needed external fixators. We had fractures. We had to fix them, so small set and large set fragments. Elderly people will get fractures. We needed DHSS and then hemiarthroplasty. We still use kuncha nails, and they work very beautifully and well too. Of course, you will need your drills, electric and air, but I always advise you to remember the manual because this may not work one day. And of course, we also had a lot of other donations from other doctors. Yes. One of the biggest problems with access to surgery is the barrier, the financial barrier. And you need to provide surgery at the very lowest possible cost. And if you have a very good government health policy, then you are blessed. In Ghana, we were blessed to have the National Health Insurance established in 2003. And also this government policy also led to the supply of very essential equipment. We had a digital X-ray, which I'm assessing here in the theater. And then we had a C-arm donated Doppler ultrasound, and very recently we've been given an arthroscopic machine. This is the website of our health insurance. Under their package, the benefit package, they take care of OPD, inpatient, and surgeries. Well, as it said, Moreskin has written in his book that quality of surgery is usually the easiest way to assess the quality of healthcare in the hospital. And of course, in as low resource as we are, we always have to think about quality. And quality has to be thought of in the same as we must make it safe, it must be effective, timely, efficient. And then it should be patient-centered. Effective, because we have to apply the scientific knowledge, and as it is, of course, everywhere, you cannot do medicine without using this. What you cannot do, you refer to the higher centers. Of course, timely, as we are working, we are all trained and we are on the ground, we are able to cover most of the cases and to reduce delays. Patient-centered. Every patient is different, and of course, in Africa, it's also a different thing. I used to make this example that if a patient has got a hip problem, probably you may want to do a total hip. There are no facilities for that. So you may consider giving him a girdle stone, because if you give him an arthrodesis, he cannot use the toilet facilities that he has got. So these are things that you need to take. Of course, efficiency means avoiding waste. And as you have seen, we go for the most basic that will make it work. Of course, Hippocrates has always taught us that we must try to avoid injury. And we think we are very equitable because we are taking care of the people in the rural areas, and we are also dealing with most of the underprivileged patients, people with disabilities which other hospitals will not touch. Yes. Well, this is a new ward, orthopedic ward that we have just built, and I think it is an effort. It is a reward to what we have been doing. The numbers of the patients are increasing, and we like to give gratitude to St. Francis Hospital, Rotterdam, and the Stichting Rotorship Volboek. I think I pronounced this rightly. Thank you very much for that one. Yes, what do we recommend? We think that for you to establish and sustain a very good healthcare, there's need for local authority, the collaboration between local authority, international donors, and then the local government. Involvement of the local doctors is very important. Or if you cannot, get a permanent specialist, like my other speakers have already said. A regular expatriate consulting specialist visit is very important. And we also need to improve the local doctors' capacity. I think I don't agree too much with this issue of us, quote unquote, isolating the African doctor. I think even if you are going to do very little, if you are an orthopedic surgeon, you should know what happens in orthopedics. And I think those expatriate doctors know so much, and they come and they are able to work in Africa. So I think the African doctors should also be given the opportunity to do. But as we do this, don't let us forget these ones. Infection control is very important. Anesthesia, as we have heard today, is important. Lab services, you can't run orthopedics without blood. And in fact, what we have learned in our experience is that equipment management and maintenance schedule of equipment is very, very important, because that is the main backbone of orthopedics. Yes. The actual access to surgical treatment is inadequate. The need to access orthopedic service in trauma, I would say in Africa, is very, very desperate. In Africa, we are low resource, but we also have a problem. I don't know what you think about this, whether it is indiscipline, whether it is just ignorance or sheer foolhardiness. And that's one of our problems in Africa. And as you are thinking about it, next slide. Thank you very much.